In simple terms, this rule states that your Social Security check cannot be reduced from one year to the next because of an increase in your Medicare Part B premium. Sounds great, right? Well, here's the catch. This protection doesn't apply to everyone. About 30% of Medicare beneficiaries are not covered by the hold harmless provision. Who falls into this group? It includes several categories of people. First, new enrollees to Social Security and Medicare. If you're just starting to receive benefits, you're not protected in that first year. Second, high-income earners who pay a higher, income-related monthly adjustment amount, or IRMAA, for their Part B premiums. The government figures if you have a higher income, you can absorb the full premium increase. Third, and this is a big one, are those who are enrolled in Medicare but haven't started collecting their Social Security benefits yet. Maybe you've decided to delay your Social Security to get a larger monthly check later on. That's a common and often smart financial strategy. However, if you're already 65 and on Medicare, you will have to pay the full Part B premium increase out of pocket because there's no Social Security check to deduct it from. And therefore no benefit to hold harmless. And finally, the group most at risk here are the dual eligibles. These are individuals with low incomes and limited resources who are eligible for both Medicare and Medicaid. You'd think this group would have the most protection, but ironically, they often don't. In most states, Medicaid programs pay the Medicare Part B premiums for these individuals. Because the beneficiaries themselves aren't paying the premium directly from their Social Security checks, the hold harmless provision doesn't apply to them. Instead, the state Medicaid programs have to shoulder the full increase. This creates a huge financial strain on state budgets. When states have to pay significantly more for Medicare premiums, that money has to come from somewhere. It can lead to cuts in other essential Medicaid services like dental care, vision, or transportation to medical appointment services that dual-eligible individuals rely on heavily. So, while their Social Security check isn't directly impacted, their overall health care access and quality of life can suffer. It's a domino effect that hits the most vulnerable populations the hardest. So let's circle back to the 2026 projection of $190.80. For someone not protected by hold harmless, that's a direct hit. But even for those who are protected, there's a problem brewing. For the hold harmless rule to work, the Social Security COLA has to be large enough to cover the premium increase. And when a large premium increase follows a low COLA year, things get complicated. But then in 2026, when this projected larger premium hike hits, and if the COLA is more substantial, Social Security beneficiaries will have to catch up. They'll not only pay the new, higher premium for 2026 but may also have to pay the difference they were shielded from the year before. A significant portion, or even all, of their COLA increase could be instantly wiped out by the jump in Medicare premiums. For those of you already on a fixed income, budgeting for these potential increases is more important than ever. It's also a good time to review your overall healthcare coverage. Are you on the right plan for your needs? Could a Medicare Advantage plan be a more cost-effective option for you? These plans often have lower or even zero premiums, though they come with their own networks and rules, so you have to do your homework. Open enrollment season is the perfect time to compare your options with the help of a trusted, unbiased advisor. On a broader scale, this situation highlights the ongoing debate about the sustainability of Medicare and Social Security. These projected increases are a symptom of a larger issue, the rising tide of healthcare costs in the United States. Policymakers are constantly wrestling with how to control these costs without compromising the quality of care. Solutions like allowing Medicare to negotiate prices for a wider range of drugs, which is slowly being implemented, are steps in the right direction, but their full impact won't be felt for years. The bottom line is that this isn't just a news headline, it's a kitchen table issue that will shape the financial reality for tens of millions of people.